Our research is titled Health Inequities in Mammography, a Scoping Review. Researchers were Matt Chancellor, Jay Modi, Rohan Muhammad, Kelsey Badioja, Elizabeth Garrett, Philo Waters, and Matt Vassar. Breast cancer is the second most common form of cancer in women, and early detection through mammography screening is associated with reduced mortality. Understanding the nature and extent of health inequities in mammography screening is essential for under-researched populations. The objective of this scoping review is to chart the existing evidence on health inequities related to mammography and identify existing knowledge gaps to guide future research. This scoping review followed guidelines from Joanna Briggs Institute and the PRISMA extension for scoping reviews. Our PRISMA flow diagram is listed as Figure 1 on this poster. In July 2022, we searched PubMed and Ovid Embase for published articles on mammography screening, published between 2011 and 2021, written in English, and examining at least one health inequity as defined by the National Institute of Health. Screening and charting were both performed in a mass duplicate manner. Frequencies of each health inequity examined were analyzed, and main findings from each included study were summarized. To ensure the use of inclusive language, our study followed the Advancing Health Equity, a Guide to Language, Narrative, and Concepts. The American Medical Association, AMA, provides this guide to highlight and standardize person-centered health inequity language. We use this guide to adapt terminology used in included studies while still maintaining the meaning and purpose of the original term. In the event that the AMA guide did not specifically mention an inequity group included in our sample, language was retained from the original study under evaluation. Following screening, our sample consisted of 128 studies. Our findings indicate that mammography screening was less likely in historically marginalized groups, patients who lived in rural areas, and women with low income status and education level. Significant research gaps were observed regarding LGBTQ+ community and sex and gender. In regard to change in research over time, education, income, race, and geography were the most frequent inequities investigated over time. There was, however, no distinguishable trends between inequities investigated over time. This scoping review highlights the gaps in inequities research regarding mammography, as well as the limited consensus across findings. To bridge existing research gaps, we recommend research into the following. 1. Assessments of physician knowledge on the LGBTQ+ community guidelines. 2. Tools for health literacy. And 3. Culturally competent screening models. Due to the importance of mammography in patient care, it is critical to understand the various inequities present and eliminate the current gaps in literature. This study is published in the European Journal of Radiology. The QR code presented on this poster links to publication's DOI and references. Thank you for your time.